As far as patient monitoring is concerned, I think there are two important things to talk about. One is the understanding, or I should say the better understanding of tools that we already use in practice for patient monitoring. For example, blood glucose monitoring, lactate monitoring, and ketone monitoring. These are things which we've already had in practice for maybe many years, but we're learning what's good and bad about the tools. A recent study out of JAVMA looked at blood glucose monitoring, and for years we've recognized that hemoconcentrated patients were reading artificially low on the blood glucose monitor. My target animals, the greyhound, for example, they always come in with PCBs of 75 or 65, and that's normal for them. If they're dehydrated, it could even be higher, and they artificially look low on their glucometer, and we didn't really recognize that to be a significant problem. You take your dehydrated or hypovolemic gastroenteritis patients, they can also look hemoconcentrated and hypoglycemic on the glucometer. And what we've studied and know now is that glucometer can actually read artificially low in a hemoconcentrated patient or artificially high hyperglycemia in an anemic patient. And so what we're learning is how to use these tools in practice better, even though they've been tools we've had in practice for a period of time. There are some other newer tools that are coming into practice as well, whether it be cloud computing type of situations or even electrodiagnostic monitoring where patients aren't even hooked up to the machines anymore. Telemedicine or telemetry is being used, so patients can be monitored cage side on computer monitors so you're not constantly interacting and disturbing them for their quality of life when they're in the hospital and they're sick.